So people come to treatment in order to get into what we call recovery from a substance use disorder. That's sort of like putting the disease in remission. And what is recovery? What does it look like? How can you tell if someone's in recovery? What does it mean to the individual to, as people say, work a recovery program? Well, the disease of substance use disorders are complicated in ways that certain other medical conditions are not. We generally say that it has biological or physical aspects, it has psychological aspects, and it also has a spiritual aspect. And we don't talk so much about the spiritual aspect of other disease. But folks who are in recovery, folks who are suffering with substance use disorder know that there is definitely a spiritual component to this disorder. And it kind of has to do with the way we think and react to life. It's difficult to put into words because we lack the language to really talk about spiritual matters in our common vernacular. And so recovery is basically a change in the way people think and react to life. In the past, people reacted to life with anger and resentment, and they used chemicals to solve their problems. And in the future, hopefully, in recovery, folks use an entirely different method of dealing with those kind of life stressors, things that would ordinarily cause them to be resentful or become very angry and then subsequently, say, drink alcohol or use an opiate or something like that. Instead, they do something else. Probably one of the most powerful tools that we use in treatment programs is the 12-step program, which is a series of relatively simple steps that encourage folks to evaluate their life and see the truth about themselves, and then learn to change that through a series of steps. And I'm not going to go into detail about the 12 steps right now, but the big book of Alcoholics Anonymous, which is one of the textbooks that we use while folks are in treatment, talks about the fact that in order to recover, people must have what we would refer to as a spiritual awakening or a spiritual experience, and that is a dramatic change in the way someone thinks and reacts to life. And that occurs sometimes over a long period of time, sometimes rather suddenly, but people find after a period of time and abstinence and effective treatment and participation in 12-step meetings that they no longer have the same desire to use chemicals the way they did before. And this generally happens without the person even realizing that it's going on. It's a difficult thing to quantify, and it's one of the most difficult things to get patients to accept, the idea that there is a spiritual component to their disease and there is a spiritual solution to their condition. We work on that while they're in treatment, but we encourage people to develop some form of that spiritual program. Again, not religious program, but very spiritual program to help folks stay in recovery and to, again, find a different way to think and react to life. And that's kind of what recovery looks like. It involves abstinence, no longer using chemicals. But abstinence is necessary, but not sufficient for recovery. Because in general, if all you do is take away the chemical substance and don't work on any of the so-called character defects that an individual has, then they don't really have the ammunition to deal with life's ups and downs and challenges, and they generally go back to what they were doing before. And that's why we emphasize these things in treatment. And that's all I got to say about that for now.